Hey, what's up, guys? Coach Nate here. Welcome back to another video. Just as a quick background, again, I got my degrees in kinesiology, biology, and chemistry from Western Washington University. I am a personal trainer and coach at a couple of locations. So I work for Exos at Google, and I work for Blunergy in Woodinville. So check it out; it's pretty awesome. And then let's kind of get right into this. Before we can talk about physics and biomechanics and all of the cool stuff that lets you optimize your exercise routine and get into a super athletic mode and become an athlete yourself, first, you have to know about, like, what are you, dude? What are you made of? Like, what do you got in there? Like, what are we doing? You know what I mean? So first, let's talk about a little bit of basic anatomy. We need to know what's in there. And we're not going to go through all of gross anatomy right now, but I am going to teach you at least what you need to know so that you can do kinesiology. So I'll try to separate this from my pre-meds who are going to be taking the MCAT, that kind of stuff. And then I'll also have some information out there for maybe my strength and conditioning coaches who want to do like the CSCS exam or something like that. So my personal trainers and my pre-meds, you're both welcome. I'm going to sandwich all this information for both of you groups of people. And you guys will learn a little bit more about the other one as well. So everybody gets to learn here and grow. So first, let's talk about it. Let's talk about the bones, the most basic part. Why do we care about the bones? What are bones? Bones are what are actually being moved. Like your muscles, yeah, they contract and they produce movement, but they are moving your bones. And your bones are moving about the joints. Okay? And your joints have different degrees of freedom. We'll talk about that in another video. So first of all, for now, we're just going to call this bone right here your cranium. This is part of your axial skeleton. So your axial skeleton is going to be your skull, your spine, and also your kind of your innominate bone or your hip bone. There's like 10 names for this thing. It's actually 3 bones: the ilium, the ischium, and the pubis. Okay, so your ilium's right here, your pubis is right here, and then the ischium's kind of that kind of third bone in the back there. So anyways, that's going to be your axial skeleton. And then your appendicular skeleton is kind of everything else that's coming around. So it's like your shoulder girdle, which is like your sternum, your clavicle, your kind of your arm here, and then you're also your legs, so like your limbs. That's your appendicular skeleton, okay? So now let's break this down a little bit further. What is that skeleton made of? So first we've got different kinds of bones. We've got like flat bone, spongy bone, long bone. You can guess what this is. This is a long bone. Okay, so towards the end you have the epiphysis or the epiphyses, and then the long part in the middle here, that's going to be called the diaphysis of the bone. Fun fact about bones, that is where like your blood is made. Like you make red blood cells in your bones. Pretty dope. Pretty cool fun fact. Now you can tell your friends. All right. Let's get back to it. What are the bones? First, we have your skull. There are a lot of bones in your skull, and we'll go through those maybe another time. For now, we're just going to call it your skull. And I guess we'll also label your mandible as well, since it's there. It's a separate part, so it kind of like kind of articulates with the skull. So they are actually separate. Let's just put C-spine for now. So cervical spine. All right. And then let's go ahead and go down here to like this, from the ribs on down to your lumbar. We're going to make a little separation here. So from here on down to there, this is going to be your thoracic spine. So your T-spine. And then this little leftover region right here, we'll call this your lumbar spine or L-spine. So if you ever heard of, like, let's say you know somebody who's herniated a disc before, and they're like, okay, it's my L5S1. Like, what would that mean? That means it's from your lumbar or L, right? So lumbar spine, and that articulates with your sacrum, which is this part kind of back here. This little bone that's kind of part of your hip bones in the back, and it connects your spine to your hip bone. That's your sacrum. It's actually, depending on the person, it's like 4 or 5 fused vertebrae together, and it's got holes in it. Those are the sacral foramen. So anyways, this right here, that's your sacrum. So if somebody herniated a disc at L5S1, that would be the disc between the sacrum and the lumbar spine, okay? So there we go. Let's go sacrum right there. And then right here, this little tiny remnants of tailbone. If we had a tail, this is where it would start. This is called your coccyx. There we go. And it's really important that you spell everything right, especially if you're, you're pre-med or you're going to go to PT school. This matters. If you're taking anatomy, is like they will take points off if you spell things incorrectly. So just make sure you're spelling everything correctly. You should probably fact check my spelling of coccyx. Pretty sure it's good, but I'm a little rusty. It's been a while since I've taught anatomy at Western. Let's see here. Fun fact about me, I actually took, I believe, 4 anatomy classes. I took anatomy and physiology, human physiology, functional anatomy alongside biomechanics, and then I took anatomy cadaver dissection lab. So that was like a graduate level course where we actually had the privilege of dissecting 2 individuals, a male and a female, yes, human bodies. So we actually got to see, like, your muscles are in a sheath. So we'll talk about your muscles later, but they are literally in sheaths of fascia, and you can see it. It's like a sword in a sheath. You can see it really well with like the sartorius and everything. So anyways, dissection and all that stuff, you're in good hands here. So the next area here, we've kind of got the axial skeleton sort of labeled, right? So this is our axial skeleton. Now let's erase this and make some room. We're going to label the appendicular skeleton. This is what you're probably going to care about a little bit more if you're a personal trainer. Obviously, there's a lot of stuff you need to do for spinal mobility. So yes, your axial skeleton really matters, especially for protecting that spinal cord and that brain, right? All right. So let's go ahead and label the clavicle. So these are your clavies right here. Your clavies, bro. I don't know. There used to be like a funny video where someone's like, yeah, I'm a clavicle guy. So there's the clavicle. You can actually feel that right across here. And a fun thing that you can do as a trainer or coach, knowing where the clavicle is. So this is one example of why it's important to know your anatomy. Because if you find the kind of the notch on your manubrium of your sternum, which is this little, I don't know if you can see there we go. Okay, so this is the manubrium of your sternum. This whole thing is your sternum. Okay. And then this little thing at the end is the xiphoid process. If that could get, if that gets snapped off into, like, during CPR, that can be a problem, right? So we kind of do our CPR 2 inches down right here in the middle, and this is the sternum. That's where we're kind of searching for, is right above the xiphoid process. But anyways, back to the training little trick that I like to do. So when I'm training someone who's never bench pressed before, or maybe I'm fixing their form from them being like, maybe their gym bro showed them how to bench, or, we're going to use anatomy here, okay, as a coach. So you're going to find the manubrium of your sternum. That's right here in the middle here where that mouse is and where I'm pointing. You can't really see on me. Then I'm going to walk across my clavicle and find the end of my clavicle. So this here, the end of your clavicle, is called the acromial extremity of your clavicle. And that's because of this right here next to it, on the other side of the AC joint, or acromioclavicular joint, is the acromion of your scapula. Okay, so all of the names make sense eventually. And another reason why you need to know all the bones is because of this is how you're going to know all the joints. This is how you're going to know all the muscles as well. All right, so walk your hands from the manubrium of your sternum across the clavicle and find the acromial extremity of your clavicle, okay? So that distance right there, if you take your hand and you place that there, now I've got this. What I'm going to do is I'm going to put my finger, I'm going to put my finger on the barbell, both of them. I'm going to put my thumb in the very middle, and then I'm going to swivel my hand and then touch the other side of the barbell, okay? Then I'm going to swivel from my finger and touch my thumb once again. That distance is your anatomical bench position. That distance right there is where you should start your bench press. Now, this is where you start. It doesn't mean you can't go out or in from there. I would say for the average person, this is how I start everyone's bench. You're going to go 2 clavicular lengths, okay, just like that. And then you're going to plus or minus 1 inch, depending on feeling, okay? So that is how you teach somebody where to set up their bench for their grip width. And then, of course, you've got all of the other stuff you have to take care of, like shoulders, back, your arch, make sure your butt's on the bench, leg drive, all of that good stuff. And we can talk about that later in maybe a biomechanics video. But for now, that is your clavicle right here. Okay. Then we just kind of talked about it. This bone back here is your scapula. So your shoulder blades, that's your scapula. Okay. And there's something really cool about your scapula is that it articulates in its own plane. So we'll talk about the planes of motion after this. And your scapula kind of, in biology, the answer is always it depends, or like there's always an exception to the rule. And because biology is kind of quirky like that. Okay. And so your scapula, you can remember this because it's special. It's got its own kind of plane of motion as well. It's called the scapular plane, believe it or not. Okay. We talked about our sternum, which is broken up into two parts here. So this is the manubrium at the top, and then you've got the body of your sternum. So I'll just say sternal body, if you can even read that. Sorry. So go ahead and erase some of this stuff here. So yeah, your sternum is broken up into your manubrium, and the body of your sternum is in the middle. And then at the very end, that little sharp tip at the end there, that is called the xiphoid process. And again, that part right there, you want to be right above that for your CPR, okay? So you can remember this whenever you, like both of you groups of people, if you're a pre-med, if you're going to be a CNA, if you're going to be a medical assistant, or if you are already a medical student, you probably already know this. And then for my pre-PT path people, you know, physical therapy and personal training, those people, you also have to be CPR certified. So this is a little edge you'll have on all the other people that are kind of taking the CPR class. So you want 2 inches down, right? And you're going at 120 beats per minute. That's like, staying alive, right? That's where you want to be. This is the xiphoid process right here. You're going to go right above that. And when you're actually doing CPR for real, they should honestly, in those models in the classes, they should really have like the rib crunch noise, because you are going to be crunching some ribs doing real CPR. It is a life-saving technique, and it is not meant to be gentle. I will tell you that. So I worked in nursing for half a decade before I became a personal trainer. And there's a couple times where I had to be there. And, I've seen the beginning of life, and I've seen the end of life, and I've seen life being saved. So anyways, just remember that this is your sternum, and this is the xiphoid process at the end. This is the manubrium right here. You have your jugular notch of the manubrium. See, all these bones have little landmarks as well. So the notch there, and then you also have your clavicular notches, of course, which is where the clavicle articulates with the sternum. And that is why this right here, this should be your sternoclavicular joint. Okay, so your SC joint. Again, all of the joints and all of the muscles are named either after the bone or after a landmark on the bone. So let's talk about this a little bit more. Again, because we already got your sternum labeled. We learned about those joints right here. So sternoclavicular, acromioclavicular. Right here, where your arm bone called the humerus. Okay, humerus. So, so funny, humor. Yeah, humerus articulates with your scapula. This is called the glenohumeral joint. And this is called the glenohumeral joint because of that little fossa, or that little kind of divot in your scapula, is called the glenoid cavity. It is not a true ball and socket joint because it doesn't actually latch onto the ball. It's just held there by all of your tendons and ligaments and all of those little like rotator cuff muscles. So that is why it's so important to have shoulder stability in your training, so that you don't get injuries, right? So it's not a true ball and socket joint. Your bones aren't going to be there to protect you, right? Okay, so that's the glenohumeral joint, and it's because it articulates the glenoid cavity or glenoid fossa of the scapula with the head of your humerus, all right? So this is your humerus. Another thing that's kind of a good segue with the humerus is that your ulna is right here, all right? And where this kind of articulates on the back with the humerus, your funny bone is not actually a bone. Your funny bone is your ulnar nerve. So whenever you're hitting that thing, it hurts so bad and feels so weird because of you're actually hitting your ulnar nerve when you hit your funny bone. And it's not very funny. It hurts, right? So anyways, that's a good transition from humerus to ulna. This right here is your humeral ulnar joint because of the humerus right here articulates with the ulna about that olecranon process. So it kind of looks like this. There's like the olecranon, which is this big part in the back, which is the hard part of your elbow. And then you have this little jut out here on the other side of that ulna called the trochlea. And then when you're at the end range, then that trochlea is in the trochlear notch. So anyways, that's just a little bit more about the bone. You're not going to have to know. You will have to know the bony landmarks, but we won't talk about every single one of them. Another thing about the humerus is that here's an example of why knowing the bones is so good. Because of right here, you have what's called the deltoid tuberosity. A tuberosity is just like a little like lump or bump where something inserts, right? So your deltoids actually insert into the deltoid tuberosity. You see how that works? So knowing the bony landmarks will help you when you're learning the muscles and then further learning the muscle actions and why all of that stuff is important. That's why it's so cool. All right, so remember, your bones are what's moving about the joints because of the action of the muscle. Okay, cool. So what do we have next? We have the radius. So if you go thumb side of the forearm, anytime it's the thumb side, that bone right there, it actually can kind of twist over your ulna a little bit. As you can see here, it's actually twisted on this side. There you go. This right here is your radius, okay? And your radiocarpal joint, right there, all right? That is where your radius articulates with your carpals. You've got 8 carpals, okay? We can maybe go through the names of all those in another video. I don't want to confuse everybody. So we've got 8 carpals, all right? Then what we have is the carpal metacarpal joint. So meta as in middle. So carpal metacarpal joint. So that's our where those carpals articulate with the metacarpals. Then you're going to have the metacarpal phalangeal joint. So your phalanges are your fingers, and you have the proximal, medial, and distal phalanges, except for in your thumb. Next, we have the on the thumb, it's a little bit different because you actually have one less phalanx. That's one of those bones at the end here, your finger bones. Same thing with your feet as well. So you have phalanges here. And then instead of carpals, they're the tarsals. So you have 7 tarsals and 8 carpals. And then the middle one, you will have your metatarsals. All right, and that's in the middle right there. So again, humeral ulnar joint, that's your elbow. And then you've got your radiocarpal joint here, all right? Now, what about if you want to twist your arm? This is called pronation. This is called supination. So you can think about this as holding a bowl of soup for supination, and then pronation is your arm is prone, or you dump the soup. Another thing, a way I like to think about this is like, this is super cringy, but it works. It's the whip and the nay-nay. So it's like pronation and then supination. Pronation, supination. Okay? So you can think about it like that. All right. So this grip right here is supinated. And then on the other side, you'll see the thumb is towards the body. That's actually going to be pronated. So right there, that's a pronated grip on that other side. Okay? Cool. And you can see like the radius right here, it's crossing over the ulna. That's because the head of the radius is like a circle, and it can actually articulate with the ulna. And this is called the proximal radioulnar joint, believe it or not. And you also have a distal radioulnar joint. which allows for a little bit of movement, but not as much as the proximal. So there you go. That is the joint there. Cool. Let's talk a little bit about the legs now. So right here we have the longest bone in your body, I hope. This is called your femur. So one thing about the femur is that when I'm looking at somebody's squat, for instance, I'm going to be checking my client's femur length. Okay, so one application here in the gym is that if you have really long femurs, let's go ahead and draw this out. So I'm going to draw from the butt first. This person right here on the left is going to have short femurs, and the person on the right is going to have long femurs. I want you to kind of visualize this and see why knowing the length of the femur might be important. So this is a short femur, and then this is going to be a long femur, okay? So to squat to a competition depth for powerlifting, for instance, or just to get the longest stretch that you can so that you can get more time under tension and a greater stretch of the muscle for a greater contraction and more results, therefore, then you need to squat to a depth. And so how to get to depth, if you have short femurs, as you go straight down like this, and then to get to depth with longer femurs, you're going to kind of have to be like this, right? So take a look at these two people. This person's right here. This person's kind of right here. Do you notice a difference between the position of these people right here? Take a look at the feet. You want your feet to be in line with your hips, to be in line with your shoulders, right? So look at this. There's that person. Here's this person. So this is where that high bar and low bar comes in. We can talk about that later in terms of like, okay, like low bar might be easier for a lot more people to lift a lot more weight because of maybe that range of motion is taken down a little bit, kind of like with the sumo versus conventional arguments as well. I'm not going to get into that too much because the comment section might get a little heated. But this person with long femurs, such as myself, is going to benefit from having that bar actually lower on their back. So like, see where the scapula is? I'm going to kind of, I wish this was backwards, but I'm going to balance that bar kind of here. All right. Now on the back, of course, and still finding your meat shelf is what I call it. So you're putting that bar on your traps instead of directly on your bone, and especially not on your C7 or your cervical spine. Okay, so you don't be putting that on your cervical spine. That's if it hurts and you have to use that pad, it's probably because of your bar position is a little off. So this person with shorter femurs now, this person is probably going to benefit from a high bar position. So that's kind of that meat shelf right here. So just below that cervical spine. So not putting it on your neck, but finding your traps, you're going to have that bar kind of right there. All right. So these people, their squat biomechanics are different because biomechanics is just physics, anatomy, and geometry all put together into one field to optimize, performance, right? So anyways, that's a good example of why it's important to look at your femur length. Another reason to know anatomy, right? Cool. So that's, once again, this is your femur. All right. Let's go ahead and erase that. This right here, this is the head of your femur. This right here, this is the landmark that I actually use to figure out how long someone's femur is. So I'll go ahead and find their knee. So this is the patella. This little bone right here, this actually increases your mechanical advantage during a squat. Having a patella is much better than not having a patella. Don't worry, most of you probably have one, unless you have a very rare condition or you just don't have a leg, and that's also okay. So I'm going to measure from there. All right, these are the lateral condyles. All right, so I'm going to measure either from the patella or from a lateral condyle of my femur, and I'm going to measure from there to the greater trochanter. So that's about this whole area. You can find that by doing what I call squash the bug. So if you feel your hip on the side and you're standing up and you kind of like do this with your leg, making a squash the bug motion, internally and externally rotating that femur, you'll be able to find this landmark right here. That's the greater trochanter of your femur. So this is how I measure femur length. I go greater trochanter, and I go either lateral condyle or I will go patella. All right. So there you go. You can measure the length of that. I literally just use a PVC pipe, and I'll use my hands, and I'll show the client, like, here, this is how long your femur is, and then we'll compare that to how long their tibia is. So this right here, the bone that articulates with your femur. So this is your knee joint right here, or guess what it's called? Your tibiofemoral joint. All right, so tibiofemoral, right? Tibia, femur. Makes sense? All these things are named after the bones, right? All right, so at your tibiofemoral joint, I'll measure down to your ankle. This right here, this little bony landmark on your fibula, this is called your lateral malleolus of your fibula. And then up here, articulating with your tibia is going to be the head of the fibula, okay? So tibia, fibula. So not tibula and fibia. Just remember that. Tibia, fibula. All right. So your ankles, you can find that bone right there. Those are malleoli. So your medial malleolus is part of your tibia, and your lateral malleolus is part of your fibula. So what I like to do to measure the length of my shank, which is the part of your body below your knee until your ankle, that is called your leg or your shank. I don't like to use leg because of it's really confusing, and when I think leg, I think the entire extremity, the lower extremity. So I will say shank for this part of the body, and I will say thigh for the part that is above that. Okay. So anyways, when I'm taking shank length, I'm going to measure from the lateral malleolus. So I'll find their ankle there, and I'll measure on up to the lateral condyle of the tibia or the head of the fibula. So I'll get this length. If that length in proportion to this length is really similar, then that person could probably, you're going to experiment, and they could do either high bar or low bar, and you're going to have to go off of feeling and vibes. If this person has a really long femur, let's say it's there, and then a shorter tibia, this is going to be a low bar person, definitely. And then if you have vice versa, if for some reason your tibia is exactly as long or longer, which makes no sense usually, than your femur, then you're absolutely going to be a high bar person. Okay, so once again, this bone should be the longest bone in your body, your femur, and if it is like only slightly longer than your tibia, you are probably a high bar person. If it is much longer, then you are probably a low bar person. Okay, so there you go. We talked about your patella. We talked about your tibia. We talked about your fibula. Now let's talk about these bones right here. So this right here, this is called your talocrural joint. Okay, this is the talocrural joint because of you have this little, I keep on forgetting what the name of that little landmark underneath your tibia is. You'll have to forgive me for now. That's where your talus, one of your tarsals, articulates with your tibia. Okay, so that allows dorsiflexion and plantar flexion. And then after that, you're going to have the subtalar joint, which is underneath of the talus. Okay, and that's going to go ahead and articulate with the rest of your foot bones. I won't get too deep into this stuff right now. I think I'll leave it there before we get off track too much. So yeah, you've got your tarsals and which include these guys right here. So like your calcaneus, for example, if you find your heel bone, like the bone in your heel, that is part of your calcaneus, and your calcaneal tendon is also known as your Achilles tendon. So if you find your Achilles tendon, it's actually the calcaneal tendon, and that's what kind of goes from your gastrocnemius and your soleus, so your calf muscles, into your calcaneus. So that's the calcaneal or Achilles tendon. Now that we know our basic bone structures, let's talk about the sections of the body. So I kind of hinted at this earlier, But if you remember, I said this is your head, all right? So we'll split the body up into just a few sections. You can split it up into a lot more than this, but for the purpose of like movement and basics, we're going to just use these 9 or 10. So we got the head, we've got the neck. These are all articulation points where joints are, where really mobile joints are. Okay. Then we're going to have the, we'll call this the arm or the brachial region. So if you know about your biceps, it's called the biceps brachii, or in beneath of your biceps, you have what's called the brachialis. So what's actually giving your biceps size is the muscle beneath it. It's much bigger. It's called the brachialis. Your biceps is actually kind of thin and small, but that's a little fun fact for you. This is going to be your brachial region right there, or your arm. Same thing with the shank leg situation. And then down here is called your forearm. Then, of course, we'll call this the wrist, hand, finger complex for now. Okay, so each one of those digits will actually have their own articulating tendons and muscles that are associated with those actions. Like even this is called opposition. So like bringing your thumb to your pinky, that's a whole nother action with other muscles involved than just like moving your thumb, adducting and abducting it, and flexing and extending, right? So for now, we'll just call this the hand, the wrist, or the finger, hand, wrist complex. All right. Then we will call this whole region right here, they will call that the trunk. So in the front and the back, that's your trunk. And let's go ahead and add your chest to your brachial region, because this is actually your pectorals are going to really move your arm. Okay, cool. So that's 1, 2, 3, 4, 5, 6 so far. Then we've got, as I said above, we're going to call this the thigh. All right, so your quadricep muscles do extension of the shank. They live in the thigh, and they do extension of the shank or the leg at your tibiofemoral joint, right? So we got, here's the longest muscle in your body. Fun fact, this is called the sartorius right there. And then another fun thing about muscles is that some muscles work about one joint, and some muscles, like this one right here, this is your rectus femoris. As you can see, it goes all the way up here to your innominate bone. So, and then all the way down into your patella and inserting on your tibia through the patellar tendon or your quadriceps tendon, same thing. This muscle is an example of a muscle that works about multiple joints. So it actually does extension of the thigh a little bit, as well as extension of the leg at the knee, right? Cool. So again, another little tangent for you. Thigh right here, and then you've got your shank right here. And then same thing with the hand. We will just call this the foot or the foot-ankle complex. You can call it the ankle or the foot, whatever, right? And again, each one of those little pieces will have their own muscles associated with the articulation in the hands and in the feet. There are a lot of muscles associated with the hands and the feet. We have a lot of fine motor control here as well. Okay, cool. So now that we know the different segments of the body, which are going to be moving, we can use those segments to kind of describe actions. So let's take the deltoid, for example, right? So our deltoid muscles, there's 3 of them, the anterior, the middle, and then the posterior. I'm working on my posterior delts myself, trying to make them a little bit bigger because my anterior and middle are a little disproportionately larger. But we have our deltoids here. All right. And what they're going to do, again, they insert on that deltoid tuberosity of the humerus. So we are using our muscle to move our bone about a joint. So this is how you describe movement. Our deltoids do, abduction of the arm, of the brachial region or of the arm at the glenohumeral joint. So that's where your head of your humerus inserts into your glenoid cavity of your scapula, right? So that's abduction. All right. We'll go over more of what the movements are in another video, but one thing is abduction is, or abduction, sometimes people will say, because of adduction and abduction sound the same. So abduction is bringing something away from the midline of your body, and then a deduction is going towards the midline of your body. So this is actually a good segue into what we need to talk about next, and that is separating the body into different like orientations and planes, and describing locations on the body. So real quick, again, these hands right here are supinated. If I had the thumb the other way, that would be what? Pronated. So let's go ahead and draw the midline of the body. There we go. So abduction that way, adduction that way. So AB and adduction, just as a little bit of a review, but we'll go over that later. All right, so this guy is pointing towards us. This is the ventral side of the body, or the anterior, right? Now, this guy that's facing away from us, he is oriented in such a way that he is showing his dorsal side of the body, or posterior. Okay? So another way you can remember this is that, you know, like cetaceans, like orcas, for example, have a big dorsal fin, and their dorsal fin is on their back. So this is, if this guy was a whale or a shark, his fin would be right here. So this is the dorsal side of the body. Okay? Dorsal or posterior. This whole side of the body, this whole thing. Okay. So let's go ahead and orient that again. So we've got ventral or anterior this way, and then this way we have dorsal or posterior. All right, there we go. And you can see there's a lot of muscles here. See if you can name any of these right now off the top of your head. I bet you know what this one is. That is the biceps brachii. There we go. And like I said earlier, this little one that's popping out, hold on, it's going to be underneath of the biceps there. That's your brachialis, okay? Anyways, right here, we're in the next section here. We talked about ventral and anterior. We talked about posterior, dorsal, and we kind of hinted at like the bone structure and a little bit of the muscles and a little bit of the actions, but we didn't go too far in depth with that. Now, this is right here another thing that you're going to need in order to describe muscle actions and just to be oriented to the body, okay? So when we move, we have planes of motion. So first we have most movement, especially in the gym, like squats, for instance, are going to be in the sagittal plane. Squats, lunges, bicep curl if it's in front of you, all that stuff. So that's going to split the body into left and right. Okay? So the reason why I wrote left and right on the opposite sides here is because he is standing in this way, because this person is standing in this way, the right side of their body is right here. Okay? So where that arrow I just drew is that's pointing at this person's liver. So that's why it's important to know the left and right are always going to be the left and right. Okay? Because that's where your organs are going to be, and that's what we'll talk about after this. So anyways, sagittal plane. This is going to split your body into right and left sides. Then we have our, and it describes movement that is in the forwards and backwards direction from the anatomical position. Then we have our transverse plane. So this is like, you know, Russian twists, anything where you're doing like trunk or neck rotation, even like supination and pronation if you were in anatomical position. That's kind of transverse plane, okay? So let's go ahead and split the body into upper and lower halves. So it splits the body from top to bottom. This right here, next to our transverse plane, this is the frontal plane. It's also called the coronal plane. So frontal, it splits the body into front and back. Or if you remember from earlier, just a second ago, This is ventral and dorsal, or anterior and posterior. Okay, so our frontal plane is going to split our body into front and back, or it's going to split, or the coronal plane, so frontal or coronal, same thing, is going to split our body into front and back. Coronal means crown, right? So it's like you're wearing a tiara or a crown. That's why this was kind of here earlier from my last talk about this. This is the frontal or coronal plane, okay? So this describes movement in this plane is going to be like that abduction, adduction that we talked about earlier. That is in the coronal or frontal plane, all right? So all of that adduction stuff is going to be in that plane. Cool. Now that we know what the planes of motion are, let's talk about the axes of rotation because of, once again, to describe movement, you need to know where this stuff is. Okay, awesome. So we talked about the planes of motion. And if you remember, this one right here, this plane right there, that was the sagittal plane, okay? You can also split this plane up into a couple of different ones. So the one in the from the midline is going to be called the mid-sagittal plane. And if I were to draw another one, let's say like through the arm, for instance, this one right here, this would be called the parasagittal plane. So para meaning like next to. So for example, like paracrine signaling in the cells just means signaling to the cells next to you, right? Okay, so we have mid-sagittal and parasagittal, or just sagittal plane. And that's going to be moving about an axis. So any motion in this plane, there we go. Or actually, hold on, I should have drew this on the middle one, because of this is where the axis of rotation that runs through the sagittal plane. Okay, there we go. And this is going to be called the mediolateral axis because it's running from medial to lateral. Okay, mediolateral axis. And then the anterior-posterior axis of rotation is here, so it's running from anterior to posterior. And this is the axis of rotation that corresponds to the frontal plane. So this is where, as you can see, if I draw a joint right here, or right here, for instance, if I'm doing motion in this kind of way, this is how you describe that abduction or abduction, right? So it moves, let's talk about this. So the deltoid does abduction of the humerus bone at the glenohumeral joint in the frontal plane about the anterior-posterior axis. Okay? So that's how you describe that. All right? So anterior-posterior, horrible S there, sorry, posterior axis. So these are the axes of rotation. Then right here, remember this one? Mediolateral axis. Okay. These also have confusing names as well, if you want to know those. So you have like the frontal axis running through the sagittal plane. I just call it mediolateral so it's easier to remember. Then, of course, you have the longitudinal, because it's long, goes through the whole body, axis. Longitudinal axis. All right, and you can guess which plane of motion this is. We've got our Russian twists, right? All of that rotation, my rotational sports, my baseball, my tennis, all of even my boxing, right? So rotation of the hips or rotation of the trunk, that's occurring in this plane right here. That is the transverse plane, and it's about the longitudinal axis. Okay. Cool. Now we've got our axes, we've got our body segments, we've got our planes of motion. We're doing great. Oftentimes in anatomy classes and just like in education in general, I feel like there's a lack of representation with respect to the female body and to using models that aren't just like white men. So I try to use as much as I can. I try to find like women of color for models. So this position right here is not true anatomical position because of the arms are actually semi-pronated, right? So those thumbs are not pointed all the way out. So this is not true anatomical position, but it's pretty darn good. All right. So real quick, let's talk about how we describe different like directions and in the body. So this is how you map out the body. If we were making a map and we're talking about landmarks like the liver or the head or something like that, we need to be able to describe where it is. So if you're doing surgery, for instance, you need to know that the lesion is like superior to this thing, right? So let's talk about it. We've got anything closer to the head, because the brain is the superior organ, is going to be superior. And then anything closer to the feet is going to be inferior. All right, this is just describing location, not how I feel about the feet versus the head. All right. Then, of course, if you let's take a limb for example. If I'm closer to the body, I'm going to be proximal. Okay? And then if I am farther out, so the more like think about proximal stability and distal mobility, I can move my hands much farther and do a little bit more mobility things with them than I can with my trunk, for instance. This is going to be distal. So proximal and then distal on this side. Distal. Okay? Awesome. Now let's go ahead and draw that midline again just to separate our body into two halves here. Anything that's going towards the midline is going to be medial. So midline, medial, right? And anything that's going out is going to be lateral, all right? So to the side, laterally, okay? So let's go and label that. We'll say medial, and then going any farther is going to be lateral. So there we go. So lateral raises are moving laterally from the midline. All right. There you go. And then let's go here and let's talk about this. Anything that is closer to the center of your bone is going to be deep. And anything that's closer to the very outside of your skin is going to be superficial. So again, you can really get into the nitty gritty when you're describing where an injury is or where you want something to be felt. So this is superficial, closer to the skin, and then closer to the bone is going to be deep too. And again, just remember that the ventral anterior versus dorsal and posterior, okay? So this right here, that is how you describe where something is. So I'm going to say, for example, that my shoulder is superior and lateral to my heart. Okay, that is literally true. If my heart is here, located in the mediastinum or mediastinum, all right, then this is going to be inferior and medial to my shoulder, which is right there. All right, cool. There you go. Let's go on to the next little area. Let's review the planes of motion and the axes of rotation. All right. So I'm going to have you guys, you can pause the video if you want to figure out what this is. Let's start with this plane right here, this red one. Okay, so what is this red plane referring to? All right. This is referring to the sagittal plane. It's going to be two T's, by the way, so S-A-G-I-T-T-A-L, that's the correct spelling. And specifically, the red one is actually the mid-sagittal plane, if you want to get super specific. Which makes this dark blue one over here what? That's the parasagittal plane. Okay? Now, what is the axis of rotation about which movement occurs in these planes right here, in the sagittal planes? That's going to be your mediolateral axis. Okay, that's right here. It runs through that plane, and all of the motion's going to be occurring in that sagittal plane, and it's going to be about that mediolateral axis. Okay, cool. Now let's go ahead and go over to the pink one. What is this pink one right here referring to? This is the coronal plane or the frontal plane. Frontal plane. All right, remember, let's give him a little tiara here. It's a horrible tiara. Let's put a little gem in there or something. There you go. So this is the coronal plane. All right, so the plane that's right here, and then that axis of rotation is the anterior-posterior axis. All right, so that axis is in the sagittal plane, and then the plane of motion is the frontal plane, and it's about that anterior-posterior axis. Go. All right, next we have our green one. What is this? This is the transverse plane. Okay, this is the transverse plane, and this is going to be about the longitudinal axis. Okay, that's that long one that goes through the whole body. Okay, let's get rid of the crown because that's for the other plane. There we go, longitudinal axis. So like our Russian twists again, right? All of our rotation at the trunk. That's transverse plane. All right, now we have an extra credit one. Do you remember from the beginning of the video, there's an extra plane and a false joint, so not a true joint, meaning it's not actually where two bones articulate. With respect to the scapula. So this action right here, bringing a hairbrush to your hair, this right here, this is called scaption, and it happens in the scapular plane about the scapulothoracic joint. Okay, so the scapular plane is kind of a combination of these three, and it happens right here. It's kind of oblique to these planes. Okay, happens like that. And I can't really draw the 3D very well, but it's like sort of like this, right? This is the scapular plane. There you go. So you can have that little trivia as well. All right, there we go. And once again, it's not really like a true... I guess it is a plane, but it's not a true, like, one of the main planes of motion because it combines these together. Okay, it shares points on a graph with all of these. All right, so that's the scapular plane right there, the extra credit one. There you go. Let's talk a little bit about the spine, and then you're going to have another quiz right after this on something else. You can guess what it's about. So right here we have three sections we're going to split this up into, and that is our cervical spine, so the cervical vertebrae. Then we have the thoracic spine. There are 12 thoracic vertebrae. They look a little bit different. And then our lumbar spine. There are 5 of them. And then we have our sacrum, which is, again, 4 or 5 fused vertebrae. And then we have our coccyx, which is another 3 or 4 fused vertebrae. Cool. So if you want to remember this, you eat breakfast at 7, lunch at 12, and dinner at 5. Okay, that's another way to remember how many vertebrae there are in each one of these. Another thing that is important to note is that, yes, C1 and C2 have their own special names, and that is because the atlas, that's the guy who holds up the globe, and he has a statue, right? So it's called that because of this is the vertebrae that's holding up your globe. It's holding up your head, all right? And it's actually going to be articulating on these facets on the atlas with your, if I remember this correctly, It's on the occipital bone of your skull. It's your, I think it's just your occipital condyles. Yeah. Anyways, so this is your atlas because your globe is sitting on top of your atlas, and that's going to allow for flexion and extension of the skull at the atlanto-occipital joint because it's the atlas and the occiput or your occipital bone or what are interacting there. Then your axis, it gets its own name as well because it has this little structure called the dens, so D-E-N-S, dens, that kind of protrudes from it. It's a little bit different, and it runs through the axis, which is on top, which is kind of wider than the rest of them. So I'm a horrible artist here, but it's got the dens, and that allows for ipsilateral and contralateral rotation of, once again, of the skull. So not necessarily the whole neck, because the neck and head are different segments. So if I, ipsilaterally rotate my head at the atlantoaxial joint, that's what that is. And then if I'm going any further, it's just going to be at the cervical intervertebral joint. So at each one of those intervertebral discs. And then you also have the hypophyseal joints, and that is just where those the bones actually articulate with one another outside of the those discs, right? Real quick, we'll also talk about disc structure. So you have the nucleus fibrosus out here, and the nucleus pulposus in here on the inside. So you have like this jelly-like substance on the inside. So you got like synovial fluid and all that good stuff. And then you have your nucleus fibrosus on the outside, which is more hard, and it's more like fibrocartilage rather than hyaline cartilage, which is like, so your pubic symphysis in the front of your hip bone and your intervertebral discs, those are a different kind of cartilage than the cartilage that is in the hyaline cartilage, which is in your other joints like your elbow and your shoulder and your knees. Maybe we'll talk about that in another video in more in depth. But for now, let's just talk about the kind of movement that occurs here. So you have actually natural spines have a natural curve, and let's start with the lumbar. So you have lumbar lordosis. So that's the curve in this direction, right? And then you have thoracic kyphosis, and then you also have cervical lordosis as well. All right, so this spine is kind of a little messed up, I think, here. It should actually be more like this, and then you have this protruding here, and then you've got this right here. All right, so you've got lordosis, and then you have kyphosis. All right, cool. So why do we care about this? Well, think about when we're talking about spinal alignment. Let's take the squat again as another good example. So a foundational movement for building strength and just for living your life, right? Oftentimes you'll see new squatters, when they have the bar for the first time, they'll squat down and then they'll do what? They'll kind of jut their butt out backwards, and they kind of have a extra curve right here. So that would be called excessive lumbar lordosis. Okay, this means you have a anterior pelvic tilt. If you tilt your pelvis forwards, like you're dumping a bucket of water in front of you, that's going to be anterior pelvic tilt, causing excessive lumbar lordosis. Okay, so to fix this, you'll have them strengthen their core enough so that they can do posterior pelvic tilt to kind of fix that, or to keep it nice and neutral, okay? I like to tell clients, we're not at the club, we're at the gym, right? So you're not trying to push out the butt and make an excessive lordosis right there, all right? So that is kind of how you remember those. Cool. Let's talk about, let's do a little bit of a quiz, and then we'll talk a little bit about kind of where our organs are located a little bit, and that'll be the end, okay? We're almost there. Let's see if you can remember this. This is going to be describing our movement and like where something is, right? So we talked about where our heart is located with respect to our shoulder and vice versa. So real quick, let's do all the way on the left. So, or yeah, on your left here. And when I point, it kind of looks like I'm pointing to the right, but I mean this way. So I want you to label this right here. This side of the body is what? That is your ventral or anterior side, okay? So the answer for this is going to be anterior. Then going the other way, what about the back side of the body? What is that called? That is your posterior or your dorsal side, right? All right. Now let's talk about, this is referring to anything closer to the head relative to the other thing you're describing is superior. Anything closer to the feet relative to what you're describing is inferior. Okay. Now, what about if you're going closer to the midline? If you're adducting, that's going to be medial. Okay. How about the other way? Let's abduct, abduction. Let's get away from the midline. That's going to be lateral. Okay. Now, how about when you're talking about your limbs and you're getting closer to your body, right? You're closer to a more stable structure. That's going to be proximal. So your proximal radioulnar joint is proximal to your distal radioulnar joint, which is distal, closer to your hand. All right. Now let's do, well, what is the one below that? That's going to be distal. Okay. Kind of talked about both of those. Now, this one right here is actually not great. This is describing something that is closer to the skin, to the outside of your skin. This is going to be superficial. Okay. And then something that is closer to your bones. So this is like the heart or something. This is going to be deep. Okay. So these arrows aren't great descriptors here in this picture, but that's okay. Now, we didn't talk about this yet, so this will be a little extra credit. What do you call it if you are referring to something on the same side of the body? This is going to be ipsilateral. So if a muscle contracts and causes rotation to occur on the same side as the muscle, that would be called ipsilateral rotation. So ipsilateral is same side. Oh, I almost wrote same side. Trying to write ipsilateral. Ipsilateral. Okay? Then, what is the other one going to be called? This is contralateral. So contradiction, contralateral. Okay? So if something causes contralateral rotation, it's going to cause rotation on the other side of where the muscle is. All right? So there's a lot of muscles in the neck that do ipsilateral or contralateral rotation. Okay? All right. So that is how you describe movement. Once again, you're going to describe movement by saying movement of either the bone or the segment of the body at the insert joint here, about the insert axis of rotation here on this plane of motion. Okay? All right. Now let's go and do one little extra review here. We're going to talk about more this is like more medically relevant stuff. Okay, so right here we've got our body cavities, all right? So let's talk just a little bit about this briefly. We talked about our planes of motion. We talked about our bones. We talked about like how we get movement sort of and how we describe movement. So now we're going to talk about the inside of our body, kind of the stuff that doesn't have as much to do with our muscles and our human movement system as much as our endocrine and like organ systems, right? So first we have our cranial cavity, That's right here. Cranial cavity. You can guess what goes in there. That's your brain. Then we're going to have our spinal column. That is where your spinal cord lives. Okay. Then we're going to have our superior mediastinum. All right. I guess I should go in order maybe. Let's go number 3. This is going to be, if you look at the entire thing, it's your thoracic cavity. But if you look at just this purple bit, this is going to be your pleural cavity. So this is where your lungs are going to be. Then we have the pericardial cavity, so out, next to or outside of the heart, and that's like inferior to your superior mediastinum. So remember how we describe movement, right? It's literally in the name, superior. Okay. All right. Cool. Then we have our thoracic. Or sorry, I already said thoracic cavity. Then we have in the lower trunk, this is our abdominal cavity, and this one we do care a lot about as personal trainers and coaches as well, because you're talking about the brace, right? You're trying to brace 360, trying to go outwards 360, like when you're bracing into a belt or not using a belt. Either way, I think a belt is a great teaching tool. But you're going to brace 360 and try to increase intra-abdominal pressure in the abdominal cavity so that you can lift a lot more weight safely, right? I've seen like on Instagram and TikTok, there's a lot of trainers will use like the soda can analogy, which is a great analogy. It's like you fill up the Valsalva maneuvers when you take a sip of air and close off that air, and then you expand into your thoracic cavity and increasing the intra-abdominal pressure like a soda can that's closed, and then you can put like a 45-pound plate on it and it won't move. And then if you have a soda can, I'll just draw this, I guess, real quick. If you open that soda can and you empty some of the liquid from it, what do you think is going to happen when you put 45-pound plate on it? It gets crushed, right? So this is that soda can when you don't have any intra-abdominal pressure. So anyway, that's why we care about this as personal trainers. So pay attention. All right, cool. So your abdominal cavity is right there. Then this is going to be different depending on if you're XX chromosome or if you are XXY or if you are X0 or if you are XY chromosome. So yeah, there's scientific like basis, like this is basic biology. There are actually more than just like biological male, biological female. Like there's actually more than just that. Like they actually have more different chromosomes. Like it's X0, that's like Turner syndrome. And then you have XXY, and then you have XY, which is like your classic biological male, and XX, which is your classic biological female. So anyways, you can use that argument if you want to, but that's biology. So this, depending on that, your chromosome that you will have different stuff in this cavity right here, number 8, okay? And that's your pelvic cavity. Cool. Let's go on to something a little bit lower now. So let's split this cavity. The most important one for us, for our sake, is the abdominal cavity. Let's split that into a couple of parts. So we actually have different quadrants to remember this. And remember, this is your right side, and it will always be your right side because your liver always lives in your upper right quadrant. Okay? So, or right upper quadrant. You can abbreviate this as RUQ. This is like medical terminology stuff. Okay? Then you have your left upper quadrant. This is your stomach. Okay? So right here, this is where your pyloric sphincter is. Then you've got your, this is the fundus of the stomach. The fundus, the body in the middle here, and then the pylorus is the end where the pyloric sphincter lives. Anyways, so the fundus and the body of your stomach are in the upper left quadrant or left upper quadrant. That's the LUQ. Then in the lower and right quadrant, stick with our order here, RLQ. This is going to be where a lot of your digestive stuff happens, right? And again, you've got your pelvic cavity down here, so maybe you have your bladder down there, all that good stuff, right? You've got your ascending colon right here is in your right lower quadrant. In your left lower quadrant, you have your descending colon. This is your hepatic flexure right here. Just for a little extra for you. So anyways, you've got these 4 quadrants, and they meet right here at the umbilicus, or your belly button. So there you go. Now let's go ahead and scroll down a little bit more and split this into a couple extra parts, which is going to be more relevant for my pre-med friends, okay? So you guys are going to have to know this as well. Okay, so let's talk about it. We have the left hypochondriac region right here. This is where your spleen is. There's a lot of blood in the spleen. So colon is going to be in a lot of places because of that's just your large intestine. You've got different colons. Like I said, you have your the hepatic flexure and your ascending colon, transverse colon, descending colon, all that stuff, right? So your spleen is what's really here in your left hypochondriac region, as well as your left kidney and your pancreas. Super important. This is going to be secreting insulin. Okay, so this is like what makes you diabetic or not, is if you have insulin sensitivity that's super high or super low. Your epigastric region, epi just means on top, so it makes sense that it's epigastric region. Then you're going to have, this is where like most of your stomach is going to be, a little bit of your liver, a little bit of your pancreas, your duodenum, a little bit of the spleen, and then your adrenal, part of your adrenal glands. Then you're going to have right hypochondriac region. Again, this is the right side of your body now. So if you touch your right side of your body, that's where this is. Your gallbladder's on this side. Your right kidney's on this side, okay? Cool. Now, let's talk about number 4. We got right lumbar. So that's your lumbar region, like lumbar spine, right? Your, again, gallbladder, liver, right colon, all that stuff. You can read what's on the screen here. Then below that, if you touch where your hip is, that's your ilium or your iliac crest. You can find that bony part on the top of your hip. That right there is where your appendix and cecum are. So if you need to get that taken out, that's on your right iliac region there. Again, this is being split into 4 quadrants right at the umbilical region. So there's the umbilicus or your navel, or also known as your belly button, right? Cool. So that's in the middle right there. Then left lumbar is just on the other side. So if you feel some pain right there, maybe you should get your kidneys checked out. All right. Then in the middle, on the bottom, that's where your bladder is. So you're talking about below the belly button here. Okay. And again, whatever organs are down there are going to be different based on which chromosomes you have and if you have any mutations in your DNA. Next, you have your left iliac, and that's where your descending colon is, and your sigmoid colon, okay? So we talked about that just above this a little bit. Now, really quick, let's go through this, and then we'll be done, I promise, okay? So just a quick little quiz, and then we'll be done. All right. So you guys should be able to see this, all right? So really quick. Okay, I saw the time and I was like, wait, that is not what time it is. Okay, it's 9:45. Cool. Let's go over this. Let's do the red ones first. Okay. So let's talk about where is the epigastric region. Go ahead and try to trace where that is. That's going to be right there. Now let's go. Where is your right upper quadrant? Remember where this is? It's on a different model. There we are, right upper quadrant. This is where your liver is, right? So like my boxers out there, I don't want to promote like causing more damage to other people, but you can knock somebody out if you hit them in the liver. So like a really hard left hook, I remember where the liver is because if you have a hard left hook, you're going to hit the right side of your opponent's body. That's where the liver is, right there, okay? So that's your right upper quadrant. Now let's talk about your right hypochondriac region. Where is that? And think about what lives there. Oops, didn't mean to move the whole thing. There we go. Okay. Now let's see here. Let's go to the orange. Why don't we? Oop, there we go. Okay, let's talk about the hypogastric region. Where is that going to be? What lives there? Think about that. It's right there. Our left lower quadrant. Right there. Okay, let's go blue now. Our left upper quadrant. I think you guys are probably getting the hang of this now. Where's your umbilical region? What lives there? It's right there. Okay. Now let's talk about our right inguinal, which is the same thing. So inguinal region, that's the same thing as that iliac region. Okay. So we talked about iliac. Inguinal is another way to describe that. So, like if you have left inguinal pain, then that's like your groin area. Okay. So here we are, and you have an inguinal ligament in this region. Okay, right inguinal, that's going to be right here. Okay, cool. Now let's go to purple. Left hypochondriac region. Okay. Let's go right there. All right. Now our right lumbar. Should be right there. Okay. There we go. Now let's go to green. Our left inguinal region, where's that at? Well, if the right inguinal is down there, the left one's probably right here, right? There you go. Correct. Our right lower quadrant, we've only got one left. There it is. Process of elimination. Okay. Now we've got one more thing left, and that is going to be your left lumbar, and that is green. Here it is. There you go. So hopefully you guys passed it. Feel free to watch this video as much as you need to. Thank you guys for watching. Again, I'm Coach Nate. Please subscribe if you're not, and then you can follow me on Instagram at _Nate_Dawg, DAWG. All right.